During American Heart Month, we're taking a closer look at heart valve disease. Here's Wendy Kuschel.
All throughout his life, James Delwich of Green Bay had a clean bill of health.
Until last year, when cardiothoracic surgeon Alex Roitstein with Aurora BayCare Medical Center wound up operating on him. James had heart valve disease.
Valves fail for a variety of reasons. They fail from stress and sort of use-related kind of failures like you would have in a car engine. You know, many years go by, the valves sometimes wear themselves out. Valves fail for a variety of reasons that we don't understand. Some of them can be genetic.
The symptoms?
By and large, they get short of breath. That's a very classic finding. They get short of breath, their energy goes down, they're fatigued more readily. They have sometimes electrical rhythm disturbances that come with valves.
It sometimes happens with age. Here's what James felt.
And in March, I had a little bit of pain in my chest, a little tightness, and I thought, well, this isn't, I kind of brushed it off. And then I sat down for supper and I wasn't hungry. And so that's very, very unusual for me not to be hungry for supper.
Dr. Roitstein compares heart disease to a house.
You have structural problems, you have plumbing problems, and you have electrical problems. Those are the three things that you could have in your house and you could have in your heart. Valvular disease falls into the structural problems. There are other things that go into structural. You could get into the plumbing problem, which is the coronary disease, okay? There's clearly interplay between one and the other, but they're two different entities. And a third one is electrical. We have a discipline of medical docs who are called electrophysiologists who are managing electrical disturbances of the heart independent of other points of the heart disease. So there's almost a spectrum of three things that is involved in heart disease, including valves, coronaries, and electrical.
Heart murmurs are one sign of heart valve problems.
If you have a murmur and you're getting on in years and you are completely robust and vital individual, and all of a sudden you begin to prefer to sit in the chair than go out to do the yard, or you don't have the energy and you sort of feel like life is passing you by, that is something that may be worthwhile looking into on a clinical basis and identify it as something as a valve problem.
And the valve evaluation requires a simple cardiac echo,
which is an ultrasound of the heart, and you don't even have to do any punctures to assess some of these valves. So you could actually just get into the heart without opening the body.
As for James, he's back to work and feeling great. To get in touch with Aurora BayCare, call 1-866-938-0035 or email them at healthwatch@aurorabaycare.com.
Thanks, Wendy. Our series on natural healing continues with a look at chiropractic care for kids. Recent statistics show about 2 million children in the U.S. receive chiropractic treatment every year. That makes it one of the most popular alternative treatment for kids, second only to taking natural supplements. And many young children getting chiropractic care get what's called an adjustment, a slight spinal manipulation designed to correct the position and movement of the vertebrae.
There are problems that are started in the birth process that are going unnoticed, and that's why, as chiropractors, we believe that all children should be checked.
There are critics who say adjustments for children aren't necessary or even safe. A recent survey shows some children are injured, although that happens very rarely. Our Natural Health series continues tomorrow night at 5. We'll be talking about yoga, find out how the ancient practice is helping cancer patients.